A local doctor says as many as 30% of his COVID patients show possible signs of long COVID. It's a wake-up call to those islanders who believe the danger from the virus has passed. The diagnosis is not always precise and the science continues to evolve, but long COVID is generally used to describe extended and sometimes debilitating symptoms of the disease. Eloisa Mayers spoke with Dr. Kyjuan Brown of NorthShore Medical about its toll it's taking on Bermuda residents.
About 1,000 patients have been treated for COVID-19 at Dr. Brown's long-haul clinic, with up to 30% displaying long-term symptoms of the disease. These include heart palpitations, fatigue, brain fog, trembling, and anxiety. Dr. Brown says a combination of therapies work, but it's new territory for doctors.
Now, in terms of long COVID, are we dealing with a new kind of disease?
It is, of course. COVID is a whole new type of virus. Even there's a coronavirus, but it's novel coronavirus. And so, yes, so this whole COVID long haul is unique to COVID and it's absolutely brand new to us.
The CDC in the U.S. defines long COVID as a wide range of new, returning, or ongoing health problems that people experience after being infected with the virus. Dr. Brown says it's still a new area of research for doctors. However, he's identified a couple of markers for what could put a person at risk.
When you see someone with long COVID, are you able to identify why exactly they have long COVID over others who just bounce back after a couple of days?
No, but what we are seeing is those patients who delayed treatment, their symptoms were a lot longer, or the whole COVID track was a lot longer or prolonged or a lot more severe. Those patients are more prone to be in the long COVID group versus those patients who sought treatment early, had the disease mitigated early, had the risk factors associated with the disease, i.e. the blood clots and all that stuff, mitigated early.
Dr. Brown says he adopts a holistic approach in treatment at the clinic, mixing traditional medication with nutritional and vitamin therapy. Health practitioners have found the majority of patients with long COVID are not elderly. They tend to be active residents in their 30s and 40s who are struggling to bounce back.
It could be young, healthy people, it could be the old, but we see a lot of the young, healthy people because they come in like, hello, I used to be able to do this and that, and now they can't do it. Like I have some guys that be working out in the gym, and there's like, I can just about do 20 minutes in the gym without being extremely fatigued. I even had one of the guys at my gym say, listen, Dr. Brown, I'm going to send you a patient because he's just not got it together. And within weeks, we was able to fix him.
The Lancet Medical Journal estimates 23 million people in the U.S. have long COVID. Public health officials in the U.S. believe long COVID has a potential to be a mass disabling event, according to a CNN report. But Dr. Brown believes treatment he administers is making a difference.
Could that happen in Bermuda on a smaller scale, considering our high rates of diabetes?
Most definitely, it could be, because remember, statistics says up to 30% of patients can develop long COVID syndrome. And that could be significant when you're looking at a bigger population. Here in Bermuda, of course, we've got a small population, but notwithstanding, we have a higher rate of diabetes and chronic diseases. But keeping that all in mind, it's treatable. And if you treat it, the patients recover quite quickly.
Medical research into long COVID has been held up by funding and resources. It remains to be seen what the long-term impacts of COVID-19 will be on the health of our community and if the condition will be treated seriously in a world eager to move past the pandemic. Eloisa Mayers reporting for Bermuda Broadcasting News.
Energy professionals